Center is a proud member of the Black Culture Zone Network, and the People's Health Briefing is brought to you as a component of the Trusted Voices campaign. We are reporting for the week of August 17th. I'm Dr. Noha Abalada, and my co-host today is Tavari Williams, Roots Navigation Manager. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with the best knowledge and thinking in 15 minutes every Tuesday morning of every week, and to answer your most pressing questions. So please submit your questions in the comments or email admin@rootsclinic.org. Let's start with county level data. Over the weekend, we surged past 15,000 cases in Alameda County, including 221 deaths. We have 181 individuals in the hospital, including 65 in the ICU, which is the highest ICU total that we have seen in Alameda County throughout this pandemic. Although we tend to focus on deaths, I'll give a reminder here that the course of this illness, the hospitalizations tend to be long, painful, and lonely. And we're beginning to learn now about potential longer-term impacts of getting sick with COVID. So although it's much more difficult to track, we should remember that this virus can cause not only death but also disability. And remember that East Oakland already has a high burden of chronic disease and premature death from things like diabetes and heart disease. So what we don't want to see, and what we're concerned about, is that in a year or whenever it happens, we're past the pandemic and everyone has forgotten about it, that we in East Oakland are dealing with a disproportionate burden of heart disease and lung disease that could be caused by the impacts of this virus. Now, even though this pandemic is worldwide, the impact is different depending on where you are. So the goal of these briefings is to give you up-to-date information on Oakland and East Oakland in particular. Some of you have expressed concerns about the technical glitches that happen at the state level impacting the flow of data. So we wanted today to show you some of our data from Roots testing site here in East Oakland. This slide is looking at a little over 9,000 tests. And again, this is looking at Roots data only. For our overall site, which does include folks from surrounding cities, we continue to have a positivity rate that has fluctuated between 12 and 14% positive, which is more than double the county's rate of 5.2%. And when we look at our adjacent zip codes here of 94603 and 94621, the positivity rate is more than quadruple the county rate. I'll say that again. East Oakland 94603, 94621 are posting positivity rates that are 4 times higher than the county average. And part of our concern here, and remember we're looking at rates, not numbers, so this is not dependent on the number of tests. But when we have a neighborhood with higher positivity rates, we would hope that we would also see higher testing rates. But when we look across the county, we are not seeing a significantly higher proportion of tests being done in East Oakland, which is what we would like to see. Even more importantly, we would like to see the people who need to get tested. If you have symptoms, if you think you've been exposed, you are top priority for getting a COVID test. You should get tested as soon as possible and quarantine yourself, especially away from those who are vulnerable to poor outcomes, which really could be anybody. Stay in isolation until you know for sure. Roots Community Health Center continues to test at 9925 East 14th in East Oakland every Monday, Wednesday, and Friday. Results are returning within 24 to 48 hours, and if you are positive, we have a team of nurses working from 8 a.m. to 9 p.m. 7 days a week to get in touch with you as soon as possible. So please pick up your phone when we call, and please pick up the phone when the contact tracers call. Their job is to work with you to stop the spread of coronavirus in our communities. Now, we know that not all of you can get out to get tested during the week, and so Roots has partnered with UCSF, Oakland Frontline Healers, Friends of Frank Staggers, Black Culture Zone, and other organizations to bring you a weekend-long testing event at Eastmont Mall at the lower lot this weekend. Here you can get a free PCR test and free antibody test for those of you who are curious about that. We know that half of Oakland thinks that we got coronavirus back in November, so you might as well come out and see if you actually developed any antibodies or if they're still persisting. There's a drive-up option for the PCR test only, and also a walk-up option. Now I want to turn our attention to other killers during the time of COVID. And I'm going to talk about what we call excess deaths. Excess deaths are the number of deaths that are over and above and beyond what we would have expected for the same time period. This slide shows excess deaths in the months of March and April. A total of about 505,000 deaths were reported in the United States, and over 87,000 of those were considered excess deaths. In 14 states, more than half of excess deaths were attributed to underlying causes other than COVID-19. In the state of California, 55% of our excess deaths were due to non-respiratory underlying conditions, including diabetes, heart disease, Alzheimer's, and cerebrovascular disease. New York City, that was hit by the pandemic earlier than us and from whom we should be learning lessons, had huge increases in deaths due to heart disease and diabetes, over a 300% increase from those causes. We don't yet have this kind of data about Alameda County or Oakland, but let's not wait for it. There is no reason to believe that we will be any different than any other parts of the country in this regard. I want to talk about another killer in the time of COVID, and that is violence. Last week we had 3 homicides in the span of just 7 hours, bringing the total of homicides in the city of Oakland to 59. That's a 20% increase over last year. And we're seeing the same thing in other major cities across the country: Chicago, Austin, San Antonio, Philly, New York. I could go on. It is tricky to draw absolute conclusions about this using murder comparisons from last year, because across the country, and particularly in Oakland, we have done an amazing job over the last decade in decreasing the murder rate year over year. However, this should still be a warning to us. Why? First, because we don't know exactly what is going on. We don't know why it's happening, but it is happening. It's happening in dozens of cities across the country. Nationwide, we see increases of phone calls for domestic violence. We know that we are seeing, even at roots, increases in depression, anxiety, and even relapses to substance. This is all to be expected in this highly stressful time. I also want to say that murders are the tip of the iceberg. Similar to what I said about COVID, we tend to focus on deaths, but death is not the only consequence of shootings. We have people who are disabled, people who are paralyzed, people who are walking around with a bullet, and we have families who are devastated and never get over their loss. This slide from the CDC shows that during late June, 40% of United States adults reported struggling with mental health or substance use. So we are seeing these increases across the board. This is hitting everyone differently, but it is hitting everyone. So 2 things I want to say about excess deaths and other killers in the time of COVID. First, take care of yourself. Reach out when you need help, whether it is with your mental health, whether it is with coping, or whether it is with your physical health conditions. It is not the time to run out of your high blood pressure medications or your diabetes medications. Give your doctor a call, get your prescriptions refilled, don't run out of your inhalers or any of your chronic disease medications. It is important that you take good care of yourself and your health, because COVID is not the only thing that could kill you. Second thing, take care of the people around you. Look out for your folks. Check on them. Give them a call. You haven't heard from somebody for a while, check in on them. People are suffering, people are struggling, and sometimes just reaching out can make all the difference in the world. And now my co-host Tavari Williams will go into more detail about struggles during the time of COVID.
First, I'd like to say thank you to Dr. Noha for allowing me to be here with her on this public health announcement. My name is Tavari Williams. I work at Roots Community Health Center. I am a navigation manager. And I'd like to talk about the increase in crime. And I'd like to start off by saying, when the increase of crime happens, we have to look at the situation that is taking place. Right now we're talking about the COVID-19. And with COVID-19, we're seeing a lot of people lose their jobs because of the shelter in place, which means lack of income. Lack of income means that now we get insecure with our roof over our head, which leads to being homeless because we can't pay that rent or that mortgage. And when one becomes homeless with dependents, or one who's just homeless himself or herself, we start to then feed ourselves and tend to ourselves by all means necessary, regardless of what the penalty may be or the cost that may be accrued with that. Someone who's speaking from experience, who has been homeless for a bulk of his high school career, sleeping in the streets, gets old quick. So I used to break into cars to get out of the rain, to deal with the weather the best I can. Starting to dig through garbage to find food to eat, and regardless of how soiled it may be. So crime picks up because some people will not go through the garbage. So they will start to steal. They will start to take what isn't theirs to fend for their family, to fend for their loved ones. So with this pandemic that's going on, with the loss of jobs and the inability to pay rent or mortgage, crime does increase. And so I would like to just touch on suicide. It's a thought. Speaking from experience, when I was homeless, I'm not proud of it, but it was definitely a thought. To escape from the pain, to escape from being rejected by life, to escape from the fact that I thought I failed. Suicide was a thought. When your stomach feels like it's eating you from the inside out, and no one's there to help you, no one's there to ease that pain, you can't find food, you can't escape from the pain no matter what you do, suicide becomes a thought. And so my heart goes out to those that are being punished or inflicted by COVID-19, who lost their job, who lost their homes, and are now homeless and have no means to feed themselves or fend for themselves. I know that thought comes in. But I implore you to come down and see us at Roots. We're located at 9925 International Boulevard, right next to McDonald's, in between AutoZone. We give away food. Dr. Noha has employed people who have lived experiences, and she allows us to navigate our gifts to help others. So allow us to gift you the kindness of love, compassion, and understanding. Come see us. Let us help you. For those of us that's been there, we don't want anyone to experience it. Every week we like to bust a myth. So the myth today that I'm going to bust is, I don't have to worry about COVID because my God got me. Let's take a look at Luke. The book of Luke, the author of Luke, who is Luke himself, the physician. He was the physician to the Gentiles, but he was chosen to write the book of Gospels, Luke and Acts. And with that, why would Jesus pick a doctor, pick a physician? We look today sometimes to see the miracle of healing without a human being. But God gave the gift of healing to those that we call doctors. And with that, let's not be naive or ignorant or ignore the fact that the gift is in the doctor of healing to heal us when we are sick, when we are wounded, when we are on our deathbeds. And during this COVID-19, I implore you as a pastor, as a faith believer, see your doctor. Go get tested. Do your checkups. For the Bible says that we are a living temple and that we must take care of our temple. This is why he gives us the abilities to go see doctors and gift the doctors the gift of healing. And the Bible says, do not test God. So don't test him to see if he's going to heal you during this pandemic, especially when he's giving you the avenue and the vessel and the lane to go see a doctor. Go see your doctor. But I got to turn this over and say thank you to Dr. Noha for all that she's done, for all the work she's put in, and for having enough faith to give those of us opportunities to navigate our gifts, and that is to help others.
Thank you for that, Tavari. You taught me something. And now I am ready. The next time I hear, I don't have to worry about coronavirus because God got me. And that is something I hear a lot. So now here's our best advice one more time. Take care of yourself. Tend to your chronic illnesses. Give your doctor a call. Make sure that you have enough medications on hand and don't ignore warning signs. Second, check on your people. Give people a call, check on your neighbor, make sure that we are all taking care of one another and taking care of ourselves during this time. Thank you for watching. Please join us again next week on Tuesday morning for the People's Health Briefing.